Некоторые ученые добиваются успехов.
With some exceptions, typically scientists are not well suited to commercialize their scientific discoveries. In order to develop commercial strategies, scientists have to interact with marketing and sales professionals. Cooperation allows each party to do what they do best. Examples of such cooperation can be found in Russia's General Physics Institute of the Russian Academy of Sciences.
Ближайшее будущее медицинской диагностики может выглядеть так.
A breakthrough technology for diagnosing Helicobacter pylori germ, precursor of gastritis and ulcer in your body, has been developed by Evgeny Stepanov, chief of the General Physics Institute laboratory. The new medical device detects the above form of bacteria through two exhalations into the device. Previous methods required taking a sample from the fluids of the stomach or from the blood of the patient.
Прибор для гастроэнтерологической диагностики.
I accidentally discovered a reaction resulting in the formation of CO in the organism. That is, it turned out that the laser enabled us to see an in-organism process within exhaled air, and we could examine these processes using our system.
Using existing methods of examining gas mixtures, Stepanov and his colleagues discovered that the content of carbon dioxide in exhaled air differs between different individuals. A series of experiments showed that the largest carbon dioxide content was in the air of the people infected with Helicobacter pylori. It as such people were under the risk of gastritis, ulcer, or even stomach cancer. The detection works as follows. The patient will consume fruit juice combined with a special chemical agent. Then a sample of exhaled air is taken. In 15 minutes, another sample is taken, and both are analyzed. Then the carbon dioxide content in the two samples is compared. The greater the difference, the higher the probability of infection. Currently, only one prototype device exists. A prototype is a sample of an innovative product that is manufactured in small quantities to demonstrate to prospective buyers and users for evaluation. Medical specialists around the world that are familiar with this new technology are eager for its commercial availability. Innovative diagnostics equipment is eagerly sought both in Russia and abroad.
Russia is among the top 3 countries in the world with the highest levels of stomach cancer. About 70% of cases are due to the Helicobacter pylori infection.
This situation can be improved. For example, just 10 years ago, Japan ranked first in the frequency of stomach cancer. But a national effort in the fight of this disease and the application of modern diagnostics methods changed the status quo.
We need one device for every 150,000 people. Just imagine the market size in Russia alone. And because this device is a much more affordable one compared to systems based on traditional technology, you can see the scale of opportunities all around the world.
Today, only one prototype exists. It is clear that scientists cannot build up production, nor can they have the sales and marketing efforts in the Russian or international markets.
That a scientist, a developer, or an engineer will just stop development at the prototype stage is very common. Scientists shouldn't try to run into brick walls by attempting to become businessmen themselves. They're better advised to work with businessmen, to form companies, to operate and enter global markets.
Western countries have been implementing this scheme successfully for a long time already. In California and the East Coast, for example, there are more than 100,000 private investors eager to offer their business skills and contacts to engineers. But in Russia, the lack of financing and skilled young specialists is not the only problem the scientists have to face.
There's a lack of, let's say, partners who could take our inventions from the development stage to production and implement marketing strategies. What's needed is to combine our expertise with those of the business community in order to reach global market penetration.
There are many issues in medical equipment market to be considered, and scientists typically don't like to spend their time solving these problems. It's hard for them to interact with engineers, let alone the businessmen.
When I worked at the General Physics Institute, I once went up to some engineers and asked why their laser still worked when, according to all calculations, it shouldn't. They answered, "Give it a rest, man. Go see for yourself why it doesn't work. We've made it work, and that's it." I was upset and went to senior colleagues to complain. They said, engineers are people who are completely different from scientists. They told me a story about Tam and Bogolyubov academics who found themselves in an alpine camp when the engine failed. Everyone looked to the great physicists for the help to repair the engine. But when the scientists looked at the engine, they looked at each other in fear, saying, "It looks like an internal combustion engine." And of course, they couldn't repair anything. Then in the morning, the maintenance men came, and they fixed it.
The team of Sergei Olympiev was luckier and managed to find a co-investor. Sergei started with a desire to create a commercial mass spectrometer. This is a device enabling to determine with precision which substances and at what concentration are present in any sample. The scientists worked out a new way to increase the device sensitivity. This should have attracted, for example, law enforcement agencies because the device could determine presence or absence of explosives and narcotic substances in an air sample. But the project was a bit late and other devices appeared on the market. Then the scientists turned to the development of mass spectrometer for medical applications. The developers saw great commercial prospects. Today, the world market of such devices is estimated at $5 billion a year.
I'm sure that in the future, this will be an interesting field, and there will be a demand in our country. The whole world is going this way of developing the market for mass spectrometer equipment, very expensive equipment. And we have two options: buy foreign devices or try to create our own. And that strategy is actually much cheaper than relying on foreign suppliers.
Such products are in high demand in toxicology departments. Mass spectrometer methods enable to determine with highest precision the cause of intoxication, which means that necessary treatment will be started much faster. Additionally, precise analytical equipment can be used in personalized medicine for determining appropriate dosage for patients. In certain diseases, for example, one single extra milligram of a drug can harm the patient. Olympiev met the investors specialized on commercialization of products and presented his development. He was successful to raise the funds to address his business challenges. A team of scientists is responsible for the scientific part of the project. Regardless of strict deadlines, partners expect success.
Our major advantage is in rapid analysis. We don't need anything like as much time to analyze a sample. And additionally, the sensitivity to a number of compounds is drastically increased compared to our competitors' devices. This is our particular niche.
A good example of commercialization of developments originating in the General Physics Institute is the Lazarit surgical laser. It was designed by David Kochiev. The work started in the 90s. A group of enthusiastic scientists then decided to implement their developments in a workable device. They were motivated by the experience and the necessity to provide for the family, because they faced a drastic decrease of Russian state funding.
Just a few years ago, the salaries paid by the Academy to junior research scientists, senior scientists, leading specialists, doctors of science, and even the Institute director himself just weren't sufficient to live on.
In order to create their first laser device, Laska, the scientists had to invest their own savings. Sale of about 2 dozens of laser units enabled the team of scientists to survive. The next generation device, Lazarit, was much more complicated and offered more features. Production of this device was financed by David Kochiev's friends, who run real estate developments.
One of the investors was Magomed Lagiev, a fellow student. Remembering our past experiences, I guess he just developed enough trust and consequently engaged fully with time and with money.
лазурит в действии.
Surgeons are effecting kidney oncotomy utilizing lazurit. A unique feature of this medical laser is that it performs several tasks simultaneously. It not only cuts tissues like lancet scalpel, but also stitches the wound. In fact, it is seaming it together. Therefore, less blood is lost, which is especially important for pediatric surgeries.
Using other methods such as biocoagulation, electrical or ultrasonic coagulation, it's generally rather difficult to stop bleeding. That's why small resections are made for cross-clamping the renal artery. That means the artery is cross-clamped for a certain time and then a resection is made. Lasers enable us to avoid cross-clamping the renal artery.
Today, the company is ready to produce 5 or 6 such units a year. Taking into account the product quality and high demand for it, the business is bound to succeed. But there is one obstacle. In order to partake in bids for supplying equipment to medical institutions, a company has to execute a great number of documents. Big competitors can afford to employ people dedicated to this task, but small companies can't afford it.
Typically, a company of just 10 to 20 employees can't comply with those huge requirements needed to fulfill the bureaucratic tasks that are associated with the company or its product. And that's predominantly due to a lack of resources.
Несмотря на трудности, которые наука испытывает последние десятилетия,
In spite of all obstacles that science has faced in the last decades, Russian scientists still develop many promising technologies. Unfortunately, they're seldom commercialized. Many facts demonstrate that innovation chain is broken. Scientists hope that there will be more businessmen interested in commercialization of new developments. Existing companies, in turn, expect that the conditions for small and medium business to participate in bids and contests will be eased. Specialists believe this would be advantageous to all market participants, offering technological innovation to consumers.
Технологические новинки.